Okay, so this presentation is about understanding and addressing violence against women and girls in Tower Hamlets. And I'll cover the following points. So just a bit about the background and purpose of the project that was conducted. I'll describe some of the patterns of the occurrence of violence in Tower Hamlets, some of the key findings and recommendations from the needs assessment, and I've got a few links and contacts at the end. And I think especially because quite a few of us are working in that space, hopefully that will be useful as far as getting in touch with different people in the borough that you might want to work with more closely. So this will be familiar to some of you, especially those that are working on the topic of violence against women and girls or domestic abuse. But just to really briefly say that VAWG, which is the acronym, and I'll refer to VAWG just because it's quicker. It covers quite a range of crimes and methods of using violence that disproportionately affect women and girls, although many of those different forms of violence will affect all genders. It's just that most of these will more often affect women and girls. And so these include domestic abuse, different forms of sexual violence, stalking, different forms of honor-based abuse, such as female genital mutilation, which is sometimes referred to as just cutting, and new forms of abuse or emerging ones such as digital or online abuse. And so just to note, as far as like looking at the interventions or thinking about what the causes of VAWG are, they obviously, gender plays a role, but other different factors at different levels that we interact with in our lives also play a role. So other factors like economic and social issues, the communities that we live in, and the propensity to violence in those communities, our relationships with family and partners and others, and also different individual factors too. So it's complex, basically, is the summary to that. There are specific groups, at least in the UK, so this is in a UK context, that experience additional barriers and issues. So I've listed a few on the screen, and I won't go into more detail than that, but I'll include some links in the presentation that I send out, so that in case you want to look more into the reports that are behind the needs assessment. So as far as the needs assessment that I mentioned, this is kind of at a point where we're looking to plan action in Tower Hamlets for the next few years, so probably the next 3 to 5 years. And there has already been quite a lot of action taken across the borough for more than 10 years. So this isn't the first time that we're looking at the topic, but actually we've had, I think this is we're coming to the end of our third strategy on the topic of VAWG, and there's been quite a lot of action taken, both at a borough level as well as nationally. So it's kind of taking stock of where we're at and how well different things are being implemented across the borough and what priorities we might need to set in the coming years. So as with most other services or issues, we have to look at our population when thinking about both the patterns of violence and then the potential barriers in access to support, or barriers in like interventions being effective for different populations. So I won't list out everything, but just basically, if you work in Tower Hamlets, you'll be familiar with the diversity of our borough, and also things like the high levels of poverty and deprivation, the issues with housing, such as the lack of affordable housing and things like overcrowding and density, and lots of other factors. But basically, these are just important things to consider when we're thinking about how well we're doing in trying to address different issues, including violence. Some of the important considerations would be the ethnic breakdown of our population, or ethnic makeup. So as I mentioned, we're quite a diverse borough, and this is, so the chart on the left is just the kind of different populations in the borough. In case you're not familiar, so we do have quite a large Bangladeshi population, particularly like a younger Bangladeshi population, but also many other different ethnic groups that are present locally. And then another important point that's pertinent to the topic of VAWG is around economic activity. And obviously this doesn't represent things like the roles that women have as carers and parents, which are really major. They're just not reflected as economically active. And so not being economically active puts people at risk of experiencing different forms of violence or just like increased vulnerability. And so we have quite a large or a lower proportion of female residents who are economically active, and that's quite important to factor in. As far as the actual occurrence of violence in the borough, we do have some of the highest rates of police recorded violence in London. And so you can see the map on the right is a map of the rates of domestic abuse. And so the darker the blue, the higher the rates of domestic abuse. This is from police data, so obviously you have to factor in that not all occurrences of violence will get reported to police, and there's obviously factors like trust in police, but also it may reflect slightly that there's better reporting in Tower Hamlets than other places, potentially. But yeah, so we do have higher rates of domestic abuse than most of London. Similarly, we have also higher rates of sexual violence and domestic homicide. And what else can I say here? FGM, I haven't got Tower Hamlet specific, or sorry, female genital mutilation. I haven't got Tower Hamlet specific data, but the kind of population demographics that we have in the borough suggest that we might have kind of higher rates of FGM than potentially other boroughs where there are lower populations of different groups of people who migrate from countries where FGM is more common, such as the Horn of Africa and different other parts of Africa. And then just to note on this topic, there are like differences in the characteristics of the people that are basically in the statistics that we have on particularly domestic abuse and sexual violence in the borough. So things like gender, as I mentioned, obviously these are relating to different forms of violence that are most common in or that most disproportionately affect women. And so for both domestic abuse and sexual violence, women are more affected than men. However, for domestic abuse, at least in Tower Hamlets in the kind of, I think, past 3 years or so, that gender difference isn't as great as you would expect. So about 2/3 of the victims reported in the past couple of years were female, while the remainder were actually male. So it's not to say that it's only women being affected, and that's quite important. Of course, the dynamics will really vary across different relationships. As far as age, people of all ages are affected by domestic abuse, although and sexual violence rather. But in Tower Hamlets, this tends to be most commonly younger adults, and in particular for sexual violence, one of the more commonly reported age groups was actually people under the age of 17. In terms of ethnicity, it's kind of very similar to what we see for our overall ethnic breakdown. Although, again, that might relate. We might see different patterns if we were looking at true occurrence of violence rather than just police reported. It's hard to say, really. As far as sexuality, I think it's only about 1% of reported domestic abuse crimes were among people with same-sex relationships. Again, that might be related to, or a low reporting of that could be related to low trust in police. I won't get into too much around disability and relationships, but I can send the full report after this. As far as different impacts on health, well-being, and economic factors, really quickly on this, just that many of the presentations to the council in the past couple of years have related for homelessness have related to domestic abuse. So about 10% each year of the homelessness approaches to the council have related to domestic abuse, at least as far as when people are expressing, like based on what people have said, as opposed to police reports. So just to note that people can have an increased risk of homelessness when they experience abuse. Also with health, it was very difficult to find kind of data, like quantitative data on the impacts on health of violence against women and girls. I think mainly because a lot of that is recorded in case notes or ways that are not that easy to kind of extract from different databases. But it was still something that when I was speaking to different professionals was like something that people would hear from service users or patients. So for instance, from the 24/7 mental health crisis line, it was something that was expressed in multiple calls. Similarly, in suicide prevention services in the borough. So there, you could expect that people experiencing different forms of VAWG would have negative mental health impacts. And then there's also physical health and emergency hospital admissions. These tend to be higher among actually men than women, but there's always the factor around the seriousness of physical health impacts and how that might vary, and how that would relate to people attending hospital. I'm going to stop there for now and just pause and see if there's any initial reflections before I go on to talk about the kind of what's in place and what the recommendations for the future are. Does anyone have any initial thoughts or questions? Does it feel like it rings true from your work?
Have we looked at safeguarding data, like adult social care safeguarding data? Because we record on the safeguarding form whether it's domestic abuse, but I think we need to get better at it. We're not always, I think we've worked out we're not always recognising or like ticking the domestic abuse box if it's like mother and son who live in the same house and things like that. So it's probably not, the numbers probably aren't as accurate as they could be.
Yeah, thank you. We in the longer report, so in the 100-page Word document that I have got data from both the children's safeguarding and adult safeguarding. And it's a really good point that sometimes it's not always coded correctly or consistently. The other thing, I guess, with the adult safeguarding data is that it would typically relate to people that have care and support needs. So it's quite a specific cohort of people, although that's still important to consider. But yeah, good point on that. Great. Yeah, and I agree that the stats are familiar but devastating. Thanks, Lydia, for that point. Did you have something to add to that?
I was just going to say as well, I mean, obviously I'm quite skewed because generally I'm working with young people, as well as parents, but mostly young people, but also the type of abuse that we know to be abuse, but the young people isn't recognizing as an abuse. So it's not necessarily getting reported through us, through MASH, etc. But actually, if a young person is consenting to some of these things, it's very hard when we're seeing quite distorted patterns of what feels safe and appropriate for some of the young people I work with, and when we feel as adults that's verging into something much more unsafe and abusive.
Yeah, that's a really good point, actually. When I was working on this project, I attended this, it was like a research conference. I forget which university hosted it, but anyway, one of the studies that was presented was on how, or it was kind of raising the question of this gap in the domestic abuse law, where actually domestic abuse between two young people isn't recognized under the law. So if people are both under, like if they're both, I guess, not adults, then it's not considered but I guess it's just a gray area, I suppose. So that may be kind of related to what you're saying. Okay. Yeah, I guess just relating to trauma-informed approaches and thinking, one of the main kind of considerations for trauma-informed approaches is that recognition that it's very common, or that trauma and experiences or adverse experiences are common in society. And so I guess this is just kind of raising a very specific and obvious uh, example of potentially traumatic experiences. Um, I'll go on to the second part, which is the kind of more hopeful side of this presentation, which is focusing more on what's being done, really. So let's get going. So this is just a screenshot from a UN publication, and there are really similar ones that are more like UK focused, but I just think this one it spells out things really clearly and simply around the types of interventions or activities that work as far as preventing violence. And so it's definitely, even though services that respond to people who are victims of VAWG are absolutely important, it's just one piece of the wider puzzle. So those like kind of broader risk factors and things that you can do to reduce the occurrence of violence are very important. So that's things like empowerment of women and increasing things like their access to economic empowerment and employment, or other ways of power in a community. Obviously, services addressing things like poverty, different forms of environments where violence might occur, and making sure those are safer. Specific attention on children and adolescent abuse, addressing things like attitudes, beliefs, and norms. Those are all like very crucial things to do in order to address violence and prevent it from occurring or reoccurring. There's also examples, these are just point form, but they're pulling from different guidance documents that are more UK focused. So just broadly, they fall into a few different categories. And this is the way that violence against women and girls, the national strategy and different like local strategies tend to be structured. So they'll focus on things like prevention and awareness in the community, and the importance of using data and evidence. And oftentimes that will look at things like education and training and addressing social attitudes. A big focus on support for victims. And one of the main things that I'll often see when I was looking in the guidance was around, I guess, support for victims that is considered to be by and for. So the importance of making sure that that victims' voices are heard and that women are involved in the development and delivery of support. Also, interventions addressing perpetrators of violence, and the different, I guess, levels of that. So thinking about both early intervention, changing behavior, and then addressing like things through the criminal justice system. And there's a big element, as I mentioned earlier, around looking at different inequalities. There's a
Sorry, Angela. Lydia has her hand up. I don't know if you want to take the question now.
Go ahead, Lydia.
That was me from before. Sorry.
Okay, all good.
Sorry, that was me not paying enough attention. Sorry about that.
Thank you, that's fine. I just wanted to draw people's attention to this publication that is specifically focused on providing effective trauma and care for, trauma-informed care for women. I think has a lot of focus on women in the context of experiencing violence. And so the different organizations involved in developing it, it seems that that's a big focus, although obviously lots of other services focus on women as well. And so these are some of the examples of what it looks like to have trauma-informed services for women. So things like listening to women's stories, building in, I guess, understanding and empathy, timely responses, and checking in with victims, that services are responding effectively and appropriately. So probably nothing surprising, but all of those things are kind of a lot more challenging than they sound. So I'll include the link there in case you want to read through the longer publication. As far as checking how we're doing as a borough, we did we conducted two different, I guess, data collection exercises. So the first was some surveys and focus groups with residents. And so when I say residents, it actually included also people who work in the borough, but not necessarily for services, as well as students and people who kind of just spend time in the borough for different reasons. Although most of those were residents and people who work in Tower Hamlets. And I won't go through all the demographics, but I guess just the main thing is that we did have quite a diverse range of people respond to the surveys and focus groups, which I was quite happy to see, just because it is quite important to understand different perspectives. And so, yeah, this is just a summary on the slide of who we heard from. As far as the residents' views, people did see that many different issues influence VAWG in Tower Hamlets. So the reason for the first question on the slide there was to get an understanding of how people view different factors that influence violence and whether those feel like common in Tower Hamlets. And so none of the response options actually stood out that much compared to the others. And it's more kind of just representing that people feel that these different factors are all present in Tower Hamlets from different people's perspectives. So things like those wider social issues, like poverty or housing, lack of education among different groups, whether it's young people or adults, misogyny or cultural and social norms that are negatively viewing women and girls, whether it's media or in other settings, or like kind of more in-person settings. Both of those forms felt, or like people seem to think that they're common. And then also toxic masculinity, or like the social norms that people have for men and boys. That was actually the most commonly selected response, although again, doesn't stand out that much compared to the other ones. Anyway, lots of issues that feel like they're increasing the likelihood of VAWG. But then we also asked people who they think could be most influential as far as addressing VAWG and changing attitudes. And it was kind of like a check all that apply question, but the most commonly selected options were male members of the community, religious and faith leaders, and schools. And obviously other groups were still selected, but it's just a consideration for who we might want to work with as far as challenging and addressing VAWG further from the perspective of residents. People also shared what they thought of services and what they feel are current barriers to accessing support. But I just want to mention that some of the issues related to VAWG that may not be captured in police data, people also reported those as like happening in the community. So things like catcalling, like different forms of what might feel like harassment in different spaces in the borough. And then as far as services, there was generally quite low awareness of services. Most frequently, people knew about domestic abuse services, but that was less than half of the respondents, and even fewer for kind of more specific forms of, or services for more specific forms of VAWG. So that's concerning, and it tells us that although some people know about where to get help, it doesn't necessarily translate to everyone just yet. So more work to be done on that. A preference for speaking to family and friends, which isn't, I guess, surprising. And this is in comparison to speaking to police or adult social care or mental health services or loads of different professionals that were listed. And it's not to say that it's not that we don't need the other services, but that there seems to be a role also for those friends and family knowing what to do and where to signpost and how to respond in the ways that would be most helpful. Some of the barriers that were commonly reported were, again, not knowing where to access support, not trusting the criminal justice system, not seeing their own experience as abuse or violence, fear, lots of different fears selected. The most common one was not being believed, but there were other ones that were kind of more specific to different people's situations. So fear of losing children, fear of a financial burden, etc. And then also language barriers. There was a question as well about how people perceived different services in terms of their helpfulness. And as far as the respondents to this survey, the ones that were viewed as, or most often selected as not very helpful were police, housing, and social care. Some of the positive things that people did say were what was helpful from the different forms of support that they had received, and the different forms of support really vary. So it's not just that the people are accessing a domestic abuse service, let's say, but from who they did speak to, the things that were most beneficial from residents' perspectives were the emotional support that they received, having someone that would listen, also the increasing awareness of VAWG, which ties back to that point around not initially seeing an experience as abusive. Another part of that is I guess relating to probably signposting or understanding what else to access, and really practical things like accessing a safe place to stay. So in some cases it was about actually having a place and not becoming homeless as a result of seeking support with VAWG. And also noting physical and mental health service provision. There's some quotes on the side, but I won't do them. They're just nice to see. We also heard from over 120 professionals across a range of different organizations and services. I think about half were from different council departments, but we also heard from different NHS services, education, community organizations, and one person from the police. And many people had participated in training on the topic of VAWG before, but many people had not for different reasons, including not having the time, not being aware of training. And so obviously, with things like staff turnover, there's always kind of more people to speak to, but that's something to incorporate in future planning. Many people were actually aware of the different domestic abuse and sexual violence services, but less so for more specific things like responding to trafficking or modern slavery, FGM, and the kind of more niche service topics. As far as the confidence with responding to VAWG and the different aspects of it, the part where people were least confident was working with perpetrators. And so this has been identified as an area to work on in the future. Lots of different gaps identified, which actually weren't that different from what residents had noted. But also things that people found helpful. So information, training, and resources. Trauma-informed approaches came up a few times in people's responses, and then obviously collaboration between different agencies. I'm not sure how I'm doing for time, and I feel like there's a lot of detail. Some of the other sources of information from residents' views were the annual resident survey and the Gender Inclusive Design Project, which if you attended the session that I think was in November, you would have seen a bit around people's perceptions of safety. Broadly, women do feel less safe in the bar than men, particularly in the nighttime. But there were some solutions that were identified in the second project around creating or fostering more feelings of safety in the borough, and a lot of that coming from working with women and girls to change the way that we use our local spaces. And for people that work with children, I want to point out some of the findings from the people attitude survey. So there were some aspects of questions around safety, and pupils generally, for like both primary and secondary school pupils, generally felt safe in their own area and the area that they frequent, so going to school. But outside of their local area, people tended to feel less safe. And because there's a kind of growing concern, at least in the council, around online safety, just pulling out information around access to mobile phones. And there was a question actually around people, like, I guess, like online safety and whether they had experienced anything unsafe digitally or online. And a quarter of the responding secondary students actually reported that someone had shared a photo with them that made them feel uncomfortable. And I don't remember the gender split there, but I would assume that girls probably experience that more often. As far as what Tower Hamlets has been doing to address VAWG, I mentioned before that we have been working on this topic for quite some time across these different categories. These are quite detailed, so I feel like I won't have time to go through every single thing, but I wanted to just point out some of the key achievements. So we do have a Tower Hamlets Women's Network that plays quite a large role as far as empowering different women to get involved in, I guess, like local initiatives. And there's been a particular focus on addressing unemployment and financial security. So that's been ongoing for at least the past few years. And there is also a focus on addressing women, their particular risk for homelessness, although there are gaps in this area as far as the different, like the availability of suitable support for women at risk of homelessness, especially when people have different complex needs like substance use or also having children. Some of the work that's been done around transforming attitudes has, I mean, there's been loads on this topic, so lots of different training that's been developed and outreach activities and like that are both general but also tailored for different audiences, including schools. But nonetheless, people are still experiencing behaviors from others that would suggest that those attitudes are not necessarily fully transformed in the community. I mentioned some of the issues related to safe public spaces and online safety, so I'll just move on. There has been work that's been focused on children and young people, but this really varies across different schools and areas, so I think it's still an area to kind of further as far as the work that's being done in schools, but also other settings that relate to children and young people and parents, and making sure that those kind of are consistent across and tailored to what is, I guess, relevant to different cultures and views, or I guess just bridging the gap so that it's not like generically delivered. There's been some engagement with men. However, a lot of the kind of allyship work has primarily been targeted at council staff, which isn't negative, but or it's not negative in and of itself, but it's still a gap in that there hasn't been as much focus on the wider community. So that's certainly a gap to address in future delivery. And that's not a finished sentence, but there has been increasing use of participatory approaches and work on, like, I guess, involving women. And so I mentioned the Women's Network, but there's also a Women's Staff Network that is led by female staff, and they lead different initiatives related to both VAWG and other issues related to women in council. There's a VAWG Champions program that is primarily led by women, including a community. So there's staff champions, but also champions in the community. So they lead VAWG related initiatives, and there are different residents across the borough. Nonetheless, one of the questions in the survey, I was actually specifically asking about this topic, and only 8% of the people who responded had actually been involved in any form of, I guess, involvement, whether that's consultation or co-production in previous initiatives. So it's still something that we could expand into more of and think of different ways to do that in the future. There's loads of recommendations that came up from this needs assessment, and I'm hesitant to read through every single one of them, but they broadly relate to those three areas of prevention and safety, and continuing to address both the wider factors that I mentioned before, so things like housing, financial insecurity, etc., from a gender-informed lens, but also the other things that I mentioned around community engagement. With supporting victims, I hope people are aware of the different services that are available for supporting victims, but nonetheless, they're listed there, and I won't read through it all, and hopefully you'll have a chance to read through the presentation after. But some of the important ones are the info service that we have that Solace delivers, also some of the sexual violence services that are delivered by organizations like The Haven at Royal London and East London Rape Crisis Centre. There are some kind of more specific issues related to access to support. So the uptake of services tends to be mainly women, which I guess it's not negative again, but because of the data that we do have on things like domestic abuse being affecting different groups, there are kind of gaps in particular demographics. And also for the particular issues around language barriers and cultural issues, there are still remaining gaps around like tailoring services for different populations. However, we're really fortunate in Tower Hamlets to have specialist domestic abuse provision for different groups. So we recently have restarted the VAWG project, which is specific to, I think, all BAME women, but particularly Somali women. And then SheWise is here, and they also have a kind of tailored focus on different cultural adaptations for women who experience domestic abuse. And then we've also got other things like Sister Circle, who provide support with FGM and other forms of honor-based violence. I might skip the housing aspect. Actually, no, because we've got some housing people here, just to really quickly note that the council is working on attaining an accreditation for, it's called DAHA, or Domestic Abuse Housing Accreditation, and it's relating to, I guess, like improving the quality of provision of housing for, or like in relation to people who experience domestic abuse and responding to it. And that's something that's being encouraged also across not just the council's housing services, but wider housing associations as well. This is still something that came up often in the surveys, both with residents and with professionals, as like still remaining gaps. So it's still an area that, even though you might get an accreditation, there's still a lot of work to be done. And then with health services, there used to be a GP-led kind of training program where GPs receive training around how to ask about and respond to domestic abuse or other forms of violence. And it actually stopped, but it's, I think, being restarted in this coming financial year. So it'd be good to kind of continue and expand that. There's also been some support provided to pharmacies in terms of being able to similarly ask about and respond to violence. And but again, it's not been delivered widely. So again, something to expand and review. And there are also a few different specialist services that I won't get super into, but again, they're listed in the report, so you'll be able to review them. These are the recommendations for supporting victims, mostly around accessible and appropriate support, ensuring that there's, I guess, quality of housing provision for different needs. And one thing that came up quite often was the lack of support for the longer term negative impacts of violence. And it may be that we're just not documenting it well, or that people don't have the access to what exists as far as longer term negative impacts, but that came up often that, like, while there is the INFA service, it's very short term. I think it's like only for kind of the initial emergency and safety issues. But as far as addressing long-term impacts like trauma and mental health, many people reported that there was limited support available for that. And then lastly, I won't go super into the topic of perpetrators, but just to note that there's been limited completion of the existing perpetrator behavior program that we do have. But there is a new one starting up that is broader as far as who can attend it. So the previous one, or the pre-existing one, was only for parents. So generally men who are parents participating in it. But there is a new program starting that is available to all adults who are not just parents, so that's positive. And definitely gaps as far as the criminal justice response. And one of the issues that is a particular gap was the specialist domestic abuse court that we did have for a few years, where there were different kind of amendments and provisions in place to make attending court for domestic abuse cases feel safer for victims. However, there were different issues related to COVID and staffing where now this is no longer in place. So that's a gap that needs to be addressed in the next strategy as well. Some cross-cutting recommendations, and that's where I'll hopefully end. So in many different areas, there was a need to look at data and insight and ensure that different programs and interventions were using the best evidence possible. And that was just something that was true across the board. So for future interventions that are being developed, a really essential component. Again, the need to increase the level of meaningful involvement of women and victims in all types of interventions. And this relates to the third point, which is around embedding trauma-informed approaches and principles. And I'm just referring on the screen that orange box is a checklist that you would have seen last time if you attended the last session, where it's from a study that was conducted at the University of Bristol, but these are kind of the main building blocks of trauma-informed organizational change. And then finally, improving the collaboration across different teams on this topic. I'll just end quickly with some links and contacts. So if you want to learn more about the different services that are available, not just for domestic abuse, but all the different types of VAWG-related services, there's a link there. And if you want to contact the team for questions about those, I've got the email there. If you have questions about this particular presentation and the report, you can email me. With training, there is a link to training on the service directory link at the top, but if you want to request specific training, Amy Kate in the council is the lead on that, as well as the champions work. And then finally, if you want to get involved in the strategic planning and the future action plan, Manara and Adam are the people that are leading on that, so I've included their emails as well. And then I think that that's it. So just really want to quickly thank people for listening, but also thank those that were involved in the needs assessment, whether it was promoting the different surveys, sharing information, and just supporting this piece of work so that we can, I guess, have the best information possible for planning. And with that, I will stop there. Thank you for listening.
Thank you so much. Oh, it's lovely. Thank you for presenting. Okay.
Thanks,
Yeah,
Linda. Does anyone have any specific questions about, it could be, because I realize I presented a lot of information, and there's more where that came from. There's a really long document, but I wondered if people had, I guess, reflections from their own areas of work.
Yeah, it's not just I've got some reflections, not necessarily from my area of work, just in general, that people think that there's this idea of violence against women and girls being a working class thing, and it's not really. Everyone. I don't know. Maybe it's me, but this idea of it's not a working class and underclass, or it's not always related to economic and socio-economic difficulties, or even cultural difficulties. It's now Andrew Tate is out, is there. So yes, there's a lot of like middle class and upper middle class people who have no problem with them. You walk but 3 steps behind, three steps behind me, woman. They will have no problems expressing that. There was that celebrity, I don't know if he is a Fox. I don't know his first name is he was just, he blatantly just said, "Oh God, who'd ever bed her? Would you ever bed that woman?" That's just like that male. It's just that's an upper middle class person. So these things, it's not just for people having. Yeah, it's just not it's not just a class thing. It's just unfortunately, there's a lot of yeah. So yeah, just want people
Yeah,
not
it's
to
a
be
really good
shocked when.
point.
Oh, sorry.
Yeah. Sorry, my connection's pretty bad, so I apologise if I'm talking over you, Linda. But
No
it's such an important point, and I think it's thinking about trauma-informed approaches. That one of the things that we hold in that is that we're also talking about ourselves and kind of our colleagues that working in the NHS or working in local council or being a professional is not necessarily a protector against abuse and domestic abuse.
Yeah.
And a colleague an elder colleague is actually looking into this as part of some research to really understand the kind of the experience of professional women in the NHS and domestic abuse. And I think the other factors, one of the things that Angela, you mentioned around shame, preventing people from seeking help, is certainly something that I've come across when I've been working with women as a psychologist, who have a professional identity and maybe a kind of identity of being kind of quite strong and powerful, but are also kind of being in a situation of domestic abuse.
Yeah, definitely.
It's very complex. Yeah,
I think it's hidden. I think that's hidden, that that aspect, that class of violence against men or women is it's hidden in that category. Whereas it's the same like with
and
drug
it's
use.
good to see that there is a women's network in the council. There's also one in Elf. So I think those networks are helpful.
Yeah, definitely.
Amanda, you have your hand up.
Yeah, I was just thinking about in terms of the rough sleeping cohort, when it comes to domestic violence, it can be really challenging to get the right or get them engaging with support. So sometimes they might sort of make, they'll sort of, I guess, maybe put a cry out for help and reveal something to a support worker, which can be quite, sometimes what they say can be really, really concerning. And then when we try and then put sort of support in place, it can be really difficult to get them to sort of engage and and get them help, it can be really challenging. You feel like you're going around sort of in a vicious circle, and often they go back into the sort of dangerous situation with sort of no further forward.
That sounds really hard as a professional to see that, and it probably, I think that probably really speaks to the impact, or like the traumatic impact that experiencing those different forms of violence can have on people, that like it might create that barrier to getting the right support and staying in that way.
I don't know how we break down that barrier. That's probably a really good way to see it, and sort of support them to sort of take the next step.
Does anyone want to respond to Amanda or from other
I was only going to say it's a common thing in adult social care as well, where it can be difficult to engage, even though we know they're in an incredibly risky situation. And usually, and we've spoken about this in our trauma-informed training and things, that sometimes I think it can feel safer to stay in a situation than it is to go into a new, terrifying, scary situation, because you don't know. The unknown is terrifying. And yeah, I think, and there isn't an easy solution to it other than kind of trying to meet the person where they're at and understand why that feels safer and how we can make the alternative feel safe as possible.
Yeah, exactly. And it came up in some of the research around issues like sex for rent, and like, I guess, not wanting to sleep rough, being like sleeping rough, feeling less safe or sounding less safe than like being with an abusive partner or someone that is physically and mentally unsafe. Lucy, was that the point that you were going to?
Yeah, I was going to make that, but then I have another point, but I'll let Lorraine come in.
Okay, go ahead. Lorraine, thank you.
No, that's fine. That's an interesting conversation. And we find that even as we're doing our posters for our new service, we need to be really careful that we're not alienating certain groups just in terms of the colours and what we're using as well, because we are trying to support men as well. And I found your presentation very interesting, especially because I'm new to Tower Hamlets. Some of the staff that we work in here won't be. But in the last few weeks, we've been going around all of our services and just to ask them, are there, is this a service that you would need internally within Look Ahead? And so many of them are saying, and quite a few in Tower Hamlets, they were saying that they just can't find services for males. And that, we've got quite a few hostels where we've got males and females who are both victim and perpetrator, and there's a thin line between the two, but we're able to get support for the women but not the male. And I understand this is a group about women and girls, but often, if we support the male, that it does have a big impact on the well-being of women. So you mentioned a few services there in your presentation. So I wondered if there was a list you could share with me of services that are for men. And the one in the council, was that just for council staff that you mentioned, which sounded so interesting? There's the training on allyship and misogyny.
Oh, right. I don't think so. I would need to double check as far as that specific training. As far as I know, with the different commission services that are commissioned by the council / the ICB, or Integrated Care Board, sorry, most of them are actually for all genders. So for instance, the IDVAs, the Sanctuary Scheme, which is a service for like modifying your home to become more safe, and a few of the other ones, like, they are for all genders. The only exception is the refuges, which are like single sex only. But yeah, I'll include in there's a list of the service directory on the one of the last slides. That would be
So I
really
think
good.
that's interesting, because I think that's part of the problem, that, you know, we've got professionals in the borough who feel that there's not services for males, but yet there are IDVA services out there that will work with men and other services, but maybe that's not publicized as well.
I think one of the things that's tricky is that the IDVA service, or at least the current one, is the provider is Solace Women's Aid. So if people see that title of the organization, they may not see themselves in as being able to access it, even though they are. Sorry, I'm just conscious of going back to Lucy's question or point that you wanted to make.
I was only going to say, do you know, it really surprised me, the figures for the same-sex relationships. It was only 1% with same-sex relationships, because anecdotally, when I speak to people, and I suppose they do say, you know, both friends and people that I've worked with, that it is hard, they find it harder to report, because it's not, they don't feel it's taken as seriously if it's somebody of the same sex who's, they, like, I've had somebody tell me that before, when they've tried to report that it was domestic violence, it was more seen as like a cat fight, or, you know, just girls bickering and what have you, when actually it's serious domestic violence. And that worries me, that how, if it's underreported.
Yeah, and I suppose that speaks to the, I guess, like, there's so much there, really. But I suppose one of the issues is that people don't always see forms of like non-physical violence as abuse, or like things like coercive control and emotional abuse, not being viewed as domestic abuse, where actually they should be.
And I think it's probably because we're doing a bit of work at the moment. I think, like I touched on, that maybe we're not recognizing as much when it's family member abuse. So it's not intimate partner, but it's family members who live in the same house, and that isn't necessarily being picked up as domestic abuse, when it comes under domestic abuse. And maybe same-sex relationships, maybe it's kind of the stereotypical, it's man and woman relationship, that is what domestic abuse is, when it's a lot wider than that.
Yeah, definitely. And it is, I mean, at least for the police recorded data, the intimate partner violence is the most frequently reported one. So it's not, obviously, like, it is common still, but those other forms, it's probably, there are things like stigma that get in the way. And there was one other thing I wanted to note on the, and yeah, I think like the 1% is really interesting for same-sex LGBT plus relationships, because we do have such a relatively large proportion of our population are, like, I don't know if people saw that at the beginning, the slide on our local demographics, but about 7% of the Tower Hamlets population are like identify as LGBT plus, or like not heterosexual. So you would expect to see more, but I think it is related to things like trust and stigma, and barriers to reporting. I'm just conscious of time. Did anyone else have any questions or comments or reflections? Lydia, you put a lot of really amazing points in the chat. Thank you.
I was just going to say, I mean, everything that everyone's saying resonates, I think, with young people, especially. Like you were saying, the services are very different. And I think the same way there's some assumptions made about professional women, or, you know, women in power or same-sex relationships, I think there's also some assumptions made perhaps about younger girls, that they're exploring their sexuality, and, you know, it's always a bit, consent's always a bit iffy at this time. And especially when you throw in the social media aspect and the use of, you know, technology. And I just, based in school, I just sometimes really worry about who is doing this work with the boys and girls. So this particular school I work in, there is a girls group that do covers off a lot of these kind of abusive sexual practices, but nothing the same happening with boys. And for the vast majority of the cases I know about in school, it is male perpetrators. So it's just who's picking this up. But this for me just feels like feeding into everything you're talking about with adults. And I'm not sure what is available. And definitely I have heard over the years just some comments, particularly from like male members of staff and male teachers, that again, well, a girl shouldn't wear short skirts and the girl should stop wearing makeup. And it's like, guys, it's 2024. Perhaps the boys should stop abusing women. But yeah, it's just really tricky, I think, sometimes to get that message across when you can hear it coming from the top down.
Yeah, that came through really strongly in especially the professional survey, but I think also from residents, that we need to focus more on involving men and boys in, I guess it's some of the recommendations, maybe I need to rejig that part, but like it refers to involvement of women in the development and delivery of things, but actually like some of the audience, like you're saying, are men and boys. And or like people of all genders. So it's important to that everyone's perspectives are include or like not just perspectives, but the ways of communicating and the issues that are raised from boys' perspective need to be reflected too. Okay. I'm just conscious of time, and I really want to make sure that I hear your feedback. So I'm going to post a really short feedback form in the chat. It literally has 3 questions. So I'd really appreciate you sharing your views, not just about today's session, but ideas for future ones. Because we are starting to do the forward planning for the upcoming year. So please do complete that. I've just sent it in the chat there. And then, as I mentioned at the start, the next session will be a facilitated one, more so around like how we're doing as professionals or as people, and trying to work in a trauma-informed way and more broadly. Patricia, I don't know if you want to say anything more about that. You're muted, sorry.
Yeah, I think just to say it isn't reflective practice, but it is our attempt to provide a safe space for people to talk about their own experiences in doing this work, which is whether it's trauma informed, but the work anyway is challenging, and so please do come and contribute as much or as little as you feel comfortable. We ask you to look after yourselves in terms of what you might share, in order to make it a safe space. So please do take time to look after yourself, and that's one opportunity that might support that.
Real, thank you. Great. That's the end for today. Thanks for listening and for contributing your really helpful views to the discussion, and hopefully see you next month.
Thank you. And thank you, Angela. It was a great presentation. It's really interesting work.
Oh, thanks. Have a nice evening, everyone.
Thank you.
Bye.